Anyway, as someone with high support needs, Access to Work has enabled me to run my own business as well as to work in some part-time roles for more than 20 years. In this time, I have supported many thousands of disabled people and people with long-term health conditions with a wide variety of issues, including access to work. As well as some straightforward signposting and information services, I've also been able to work with individuals with more complex difficulties, both as an advocate and as a facilitator, and in my role hosting the work advice service for the Association of Disabled Professionals and their Disabled Entrepreneurs Network. Access to Work has therefore enabled me to develop a thriving career. But my need for access to work support has also resulted in professional and financial difficulties, as well as fear and distress at each renewal or on occasions where I had to report a change of circumstances. And I know all the guidelines and the guidance that staff use, and that's how I feel. But as we've seen today, I am not alone. I have also become increasingly aware that my experiences mirror the experiences that clients from our work advice service encounter. Inappropriate attitudes from advisors have had very negative impacts, whether they are expressed to the individual or their employer. A telling example of this, when we were sent a copy of an email from an Access to Work advisor to an employer suggesting that their employee's request for a Braille copy of their workplace assessment was a waste of taxpayers' money. This cannot certainly be regarded as an appropriate response from an organisation purporting to be supporting disabled people to gain and remain in work. Obstacles are also created when demands for information that cannot be met are made to the individual. This has resulted in desperate calls from people, as entrepreneurs have been told that Access to Work must receive a business plan with full financial forecasts within 10 days. Despite the fact that the person is unable to complete a business plan without significant personal assistance or assistive technology, and that's the reason they're applying for Access to Work support. Others have received requests for 3 quotes from agencies with regards to support worker costs, despite the individual working from home in the rural Highlands of Scotland, where the nearest and only agency was between 1.5 and 2 hours away. I am aware of various situations where an individual is asked to apply for support for each and every meeting they attend. This is despite the fact that it has been clearly stated in their job descriptions that they are required to attend a meeting a minimum of X times per month. This is not only impractical, but also prevents the person from being able to do their job. So, we have reports from many individuals and employers stating they have had conflicting information from Access to Work. Further examples include a deaf employee being told that their interpreter support was the responsibility of their employer as a reasonable adjustment. An entrepreneur being refused Access to Work support altogether as the advisor did not know the difference between the term turnover and profits. A disabled employee who was working for 3 hours a day after returning on a phased return to work from a significant brain injury was asked to contribute £40 a day to his taxi fare and his travel to work support, despite the fact that he was entitled to free travel on public transport. And the list goes on. Can I also say though, 100% of those cases have been backtracked on reconsideration. We have been successful in every single one, despite the massive increase in requests for that service. But we have this idea that these issues create minor inconveniences. That is not the case. With such a vital provision, the impact can be whether someone is able to work or not. All of these difficulties have a significant effect on well-being of individuals, their relationships with their employer, and their interaction with colleagues. It's therefore not surprising that these obstructions also lead to significant distress. Indeed, for many of our clients, the distress caused by previous experience of contact with access to work has been so profound that they now refuse to interact with advisors directly and have appointed me as their representative. This is particularly disheartening when the Access to Work scheme has been held as a pillar of hope for so many disabled people who could not consider work of any kind without this support. It also clearly highlights the fact that although everyone agrees that access to work is an invaluable support for very many people with impairment-related needs at work, the current systems and processes used may no longer be fit for purpose. So, what can we do about these barriers? Our work advice service uses a practical, common sense approach with very experienced disabled advisors to work with people with all impairments and in all work roles, employed or self-employed. We advise using a solution-focused support to find out what the barriers actually are and then collaborate with others to find solutions to the issues raised. Following these principles of solution-focused support results in appropriate, accurate, clear and accessible information and communication, which is vital so that people can make informed decisions and choices about their support needs. It also increases the awareness and understanding amongst employers so that we can ensure that a more equitable workplace is established as perceptions of disabled people are improved and understanding of the impact of barriers at work are also more evident to them. In this more facilitative environment, other employees in the workplace are also more likely to declare a need for support, and line managers are much more likely to be trained appropriately to receive such requests. So, in conclusion, my key messages are reframing our thinking about access to work for disabled people and people with long-term health conditions is vital. Only in this way can we develop tools and strategies that facilitate co-production and improve partnership working between disabled people, employers and access to work, as well as accessible information that enables people and their employers to make informed decisions about current and any future support needs. It is only in this way, where each party has a shared knowledge of available resources, that we can implement holistic solutions that meet the needs of individuals, employers and informal community networks in a more cost-effective manner. Thank you for listening.